Hello, this is Dr. Scott Kilbrook, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about the treatment of a mild ankle sprain. In a future video coming soon, I'll talk about treatment for very severe ankle sprains, but in this video I'm simply going to talk about mild ankle sprains, the more common variety that most people deal with on a day-to-day basis. The ankle joint is basically the joint that allows your foot to connect with your leg. The ankle joint itself is composed of three different bones. The two leg bones, the smaller one being the fibula and the other larger one being the tibia, and the talus, which is a dome-shaped bone that is found on top of the foot itself. Now the motion of the ankle joint is generally an up and down motion, allowing the foot to go up and down on the leg. However, there is still a little bit of motion that can occur in a different direction, in which the ankle can twist and turn a little bit. Now, this motion is not excessive and is restricted by ligaments that cross between the bones of the leg and the bones of the foot that kind of hold the ankle joint in place so that there isn't too much rolling of the ankle, which would make walking very difficult to accomplish if one constantly was rolling their ankle. The more common area that people have a sprain in their ankle, which is essentially a tearing or a stretching or some type of injury to one of the ligaments that bind the ankle together. The most common area where a strain will occur is actually on the outside of the ankle. The ligaments that form the inside of the ankle are actually very tight, very strong, and essentially in one large sort of triangular shaped piece. And so spraining of the inner side of the ankle is less common. The foot would tend to have to roll sort of in an outward direction rather than an inward direction. And this doesn't happen as frequently as the other direction. So the more common sprain is actually in which the foot rolls inward on the ankle, which essentially stretches the outer ligaments. Now there are basically three. This bone model doesn't show them, but I'll sort of point to where they would be. The first ligament is the more common one that is basically torn or injured or irritated ankle sprain, and it basically runs in a direction like this. There's another more centrally located ligament that attaches like this, and then there is one final ligament that kind of runs in this direction around the back. And essentially the first one or two ligaments are usually the ones that are torn or stretched or irritated when one rolls their ankle inward and sprains it. Now, a mild sprain is essentially one in which the tissues are damaged, maybe not necessarily torn all the way through, but damaged enough that there is pain, there is swelling, there can sometimes be bruising, and is generally difficult to walk. However, in the case of a mild sprain, people generally are able to bear weight on an ankle that has been sprained in this manner. In fact, some of these don't even hurt until a little bit later on. Treatment's kind of important because if one doesn't necessarily treat the ankle sprain, even if it's very mild, in a timely manner, the condition of the tissue of the ligaments can worsen over time, and instead of having a more mild sprain, a more serious injury can occur over time as these ligaments begin to weaken and eventually may even tear outright as a result of the weakening. Treatment for a mild sprain is very simple, and many people already know what to do, but often don't know why they're doing it. Very simply, one needs to rest. One needs to reduce activity on the ankle, on the foot, in order to allow the tissue to calm down, for the inflammation process to subside, and so that no further tissue damage takes place. Icing is important because icing will reduce the inflammation process, which will help to reduce pain associated with an ankle sprain. Elevation also helps to reduce inflammation by keeping gravity from allowing fluid to accumulate in the ankle as a natural result of the healing process that's going to take place. Now, these measures aren't going to restrict the healing. They're not going to end the healing process that started by the body's natural inflammation response, but it'll reduce this overproduction of inflammation that causes much of the pain of these types of injuries. And then basically compression is also another key, which also helps to reduce sort of the filling of the tissue around the ankle with fluid as a result of the inflammation process. Now this is fairly easy to do at home. A ACE bandage can also often be utilized to compress the ankle tissue itself, and it also stabilizes the ankle joint somewhat. The use of a commercial grade ankle brace is also helpful. Sometimes they offer some compression, but the main benefit of using a commercial grade ankle brace, also known as a gauntlet brace, is to basically stabilize and secure the ankle so that when one is walking on it and trying to get around, the ankle has less of a tendency to pitch inward and roll in. Now most mild ankle sprains should start to feel somewhat better, if not significantly better, within a couple weeks' time, although it can take up to 3 to 4 weeks for even mild ankle sprains to start to feel better enough that one feels more like themselves. And in some cases these can even take longer depending on the integrity of one's ankle tissue. However, if pain is persisting past this 3 to 4 week time period, or if severe pain is present and worsening or persisting past 2 weeks, the ankle really needs to be looked at by a physician to make sure that no further damage has taken place. Well, next time I will talk about more severe ankle sprains and what some of the implications are regarding those. I hope you enjoyed this video. For more information on foot and ankle conditions, please see my website at www.inpodiatrygroup.com. Thank you.